Well, good morning, everybody. Glad to see you all here again today. And Julian Sale would have been introducing Mr. Jim Brown. He knows Jim quite well, I believe. But he's not here today, so he's left it to me to do the honours. Jim says he began his career with Toronto Paramedic Service and worked in many different areas of the city. After 17 years, he moved on and began working for Guelph Wellington Paramedic Service. He worked on the ambulance for several more years and was part of the service education team before becoming a field superintendent. He recently began a new role as acting commander of training and recruitment, and he's been a resident of Guelph for 18 years and lives here with his wife and two daughters. Jim Brown is part of the emergency medical service for Guelph. He'll be speaking about the fascinating and somewhat surprising history of emergency medical services in Guelph, Wellington. He'll also share how EMS operates today and some of the challenges they face. I believe you're going to have some interesting stories for us. Thank you. To finish, Jim will talk about how we as seniors can best prepare for the day we might require EMS support. This information plus the File of Life card he will hand out could save your life. And I'll leave it to Jim to talk about the File of Life card. Thanks. I seem to have an echo. I don't know if that's going to trouble you, but it might be okay with your talk. Thank you. So please join me in welcoming Jim Brown today.
Thank you very much. Can everybody hear me okay? Yeah? Okay. Just let me know if you need me to speak up at all. So thanks very much for the introduction, Graham. Appreciate that. As you said, I'm just going to give a brief overview of the history of paramedics in Ontario, talk about what Guelph Wellington Paramedic Services can offer, and then speak about a couple of medical issues and how we deal with them, and what you can expect if you have to call us ever. So the history of paramedics in Ontario is quite an interesting history. Back in the 1830s, there was a really, really bad cholera epidemic. I'm sure everybody's heard of that at some point or another. And this led to the introduction of cholera carts. They were carts pulled by horses, and they were elongated in order to fit people lying down. So bodies of those that have died and those that are really sick. It was the first generation ambulance. There were so many dying and dead that the need arose to have the specialized carts built. Toronto's first mayor, William Lyon Mackenzie, was an attendant on a cholera cart. The first municipally funded ambulance service began in Toronto in the late 1800s, around 1880, and it was comprised of one horse-drawn carriage for the entire city. There's a depiction of what it would have looked like back then. So the early 1900s saw the rise of private ambulance services. They were commonly run out of funeral homes. Up until even into the 80s and 90s, that was the case. Sometimes they even used the same vehicle. So they had the vehicles, as you can see here, they had the hearses that you can convert from a hearse into an ambulance if needed. So this usually, or it most likely arose because of they possessed a carriage or a vehicle that could transport someone lying down. No one else did. So it was a need that was discovered, and they had the answer. Also, they were a 24-hour service, and the workers were better educated in anatomy and physiology than the layperson. So they had a little bit of extra knowledge, and that's where the funeral home started providing ambulance service. The first motorized ambulance hit Ontario in 1911, and it was run out of a Toronto funeral home. The ambulance that you see on this picture, though, is, I believe, is a 1914 version, and it was donated by Sir John Eaton of the Eaton department store fame, and it ran out of Toronto General Hospital. But that's similar to what you would have seen the first motorized ones in 1911. Throughout the early to mid 20th century, there was a huge growth in ambulance services. They popped up everywhere. They were based out of many different locations, including, as we talked about already, the funeral homes, fire departments, hospitals, even many hospitals had ambulance services, and even brewery ran them. The John Labatt Corporation operated an ambulance in London, Ontario between 1941 and 1966. And it was staffed by employees of the brewery who were trained in first aid by St. John Ambulance. Sometimes it would even be called into service as a backup resource in the community if needed. So the police would call them and get them out if they needed them as an extra resource. Speaking of St. John Ambulance, this area into the mid-20th century saw an increase in training for those working on the ambulances. Organizations like St. John Ambulance and the Canadian Red Cross began teaching ambulance staff and the public in first aid. All of my service educators at Guelph Wellington Paramedic Service undergo yearly our service educators are all trained CPR instructors by the Red Cross, and all of our employees undergo annual CPR recertification through the Red Cross. So even we have to do it every year. Ambulance services remained pretty much unregulated until the mid-1960s. Many problems arose due to that lack of training, competition, and some shady business practices due to the lack of regulation. So in the mid to late 1960s, the province hired Dr. Norman H. McNally to standardize some care. Dr. McNally was a retired Army surgeon, and he was hired to develop a balanced and integrated system of ambulance services throughout the province. Dr. McNally is considered the father of modern paramedicine in Ontario. He was responsible for standardizing equipment and training for ambulance workers. The Norman H. McNally Award recognizes acts of bravery by paramedics in the performance of their duties. It's given out every year at the Chiefs Conference held throughout Ontario, depending on who's hosting. On a side note, I have one of these awards. It was a big honor to receive it. I was trying to find a picture of the award so I could show you, but it's just a wooden plaque. Dr. McNally is known for developing standardized training, as I said, for ambulance personnel in Ontario, and this began as only a 4-week course out of CFB Borden. Now, in order to become a certified primary care paramedic, which everyone who begins their paramedic career now begins as a primary care paramedic, and students must complete a 2-year college program to pass an exhaustive provincial exam afterwards. It's quite a long exam. Takes almost a day to write. They're actually looking at increasing it to 3 years because the curriculum has had to expand so much with the knowledge and the equipment and things of that nature. University of Toronto has begun to offer a Bachelor of Science degree in paramedicine as well, so people can receive a university degree. It's in conjunction with Centennial University, or sorry, Centennial College. In 1969, they introduced a new vehicle and equipment standards, along with common radio frequency throughout Ontario. This is a picture of what the standard ambulance would have looked like back then. So all services would have had to go to this model. The 1970s saw a lot of changes, including these equipment standards improvements, and the release of the Ambulance Act of Ontario in 1975. So the Ambulance Act defines the requirements of training, equipment, documentation, and records keeping for all ambulance services in the province. This mitigates that shady practice, and it allows us to keep our standards high. 911 wasn't introduced until 1982. Prior to that, each municipality or region had their own emergency number that you had to call. So in 1982, they brought out 911, which is fantastic, so everybody knows what they need to call instead of having to look up the number for the local ambulance service. Locally, we had in Guelph, we had the Royal City Ambulance, and prior to the Guelph-Fergus ambulance, after the Guelph-Fergus ambulance, with the Royal City Ambulance in Guelph and Fergus as well. The Royal City Ambulance Service was established within Guelph in the 1950s and expanded to providing services in Fergus in 1978. I think prior to that it was called the Fergus District Ambulance Service. It was contracted as the sole land ambulance service provider to Guelph and Wellington in 2001. When they had the municipalities, everything was downloaded to the municipalities. So many of the towns in Wellington County had their own ambulance services prior to this. Right now we cover from down in Puslinch all the way up to Mount Forest. We go as far east as Hillsburg or Rockwood, as far west as Minto Township in Harriston. So we cover a very large area. But a lot of those towns had their own ambulance services prior to this. They had Mount Forest Ambulance, Palmerston District Ambulance, and Fergus District Ambulance. So, forgive the poor picture quality here. I was trying to find some local advertisements, and we have some things put up in our headquarters. The Royal City Ambulance. The picture on the right is from the opening of the Fergus base as the headquarters of the Fergus Royal City Ambulance in Fergus. That's still currently our base there in Fergus. And as you can see in those pictures, the changes in the vehicles that we use has been quite varied in the last, several decades even. Went from station wagons to vans to the new cube-like ambulances that you see now. This is a picture of what we currently use. In 2009, the city of Guelph took over. They took over operations of the ambulance service from Royal City. And Guelph Wellington EMS was born. So now we are Guelph Wellington Paramedic Service. As I was saying earlier, we cover a large area. We cover over 2,600 square kilometers. And we service approximately 250,000 residents, all told. And we do approximately 30,000 calls every year. And it's increasing every year by, 1,000 or so. We have 10 stations in our area, and we currently have over 200 paramedics. I just recently had a new recruit class finish at the end of May. We've welcomed another 24 paramedics to our service. So in the times from funeral homes running the service, and hospitals and breweries, there's been a lot of advances in technology. You can see on the left, I don't know if anybody remembers the show Emergency from back in the 70s. Great show. Actually, probably still one of the most accurate medical shows that they've ever made. But you might recognize the cardiac monitor on the left that Johnny and Roy used. That could weigh up to 100 pounds. You can imagine lugging that thing around day to day. The stretcher on the right was the first form of stretchers that were used, and they started on the ground. There's no way of lifting the patients up into a higher position, so they were backbreakers for sure. The paramedics had to bend down on either side and lift the stretcher right up into the back of the ambulance, shrug it in. As opposed to now, we have our current monitors that we're using are on the left there. It's the Zoll X series. And on the right there is the Stryker stretcher that we use. It's an automated stretcher. It's got hydraulic system and electronics on it so that we just, with a touch of a button, we can raise and lower it. And our ambulances even have a power load option that will load the stretcher into the ambulance for us without having to lift. So it's a lot better on the paramedics' backs and shoulders, etc. It makes it a lot easier for us to get access to people and lift them up. That monitor does a lot too. They're still pretty heavy. They still weigh maybe about 30 pounds, but what they do is phenomenal, the amount of things they do. It's like we basically run a little mini ER. So we can do things such as intubations, chest decompressions. We give many medications, for example, to make your heart go faster or to make your heart go slower. There's been a lot of advances in the services that are provided throughout Ontario as well. That's a picture of one of the newer orange ambulances, air ambulances. And we coordinate really well with them on certain calls. They'll do actual scene, they'll land on scene, take over care of the patients from us and transport directly to trauma centers. We also have a very robust community paramedic program in Ontario. Guelph Wellington Paramedic Service actually started one of the first community paramedic programs in Ontario. The goal of the community paramedic program is to reduce the number of repeat emergency medical service calls, reduce the number of low acuity patients in the emergency department transported by paramedics, and to enable people who are vulnerable or at risk or older adults in order to live safely in their home and reduce the use of more costly care, such as an acute care hospital. If you're ever interested, our community paramedic program could actually do a whole presentation on what they do. I'm not part of the paramedic program, community program, so I can't speak to everything they do, and they're continuously expanding their services. It's amazing what they can do. They even do point of care testing now, where they'll go to a patient's house and they can do some blood testing to determine things without the person having to make an appointment to go to the doctor or go to the hospital. And they're continuously finding advances and ways to keep people at home and to not have to go to the hospital where they could be there waiting for hours. Last year, they estimated that they saved approximately 1,500 ambulance calls, 911 calls, from the work that they did. So it's a huge, huge help when you're looking at 30,000 calls a year. So they do such things as they run CHAP programs, which they go to residences and buildings that are primarily seniors, and they'll set up in the lobby or somewhere in a community room or something, and people are welcome to come down, and they'll get a quick rundown of medical issues, answer any questions people have. They also provide remote patient monitoring in patients' houses in order to support people with long-term and complex medical issues, and those who have difficulty accessing care on their own, because they're unable to move as well as they used to be able to. I've included outside a pile of community paramedic business cards. It's got all the information there, so if you ever have any questions or you feel that you or somebody you know needs support, those business cards are great access to any information that you may need. Someone's there, they'll be able to answer your questions. The community paramedic program also provided COVID testing and vaccines to homebound Guelph residents and residents of Wellington County. So that's a picture of them there. They were also called the Swab Squad. They did a lot of great work during the COVID-19 pandemic. Guelph Wellington Paramedic Program also ran a bicycle program as well, bike medic program. We're looking at re-implementing that. We had to stop it during COVID also with some staffing difficulties, so that was one of the things that we had to put a pause on, but we're looking at getting that started again. They're a great program where they go to festivals and events, or even downtown during SAFE semester when the students come back to town. Just gives us very good access to patients if needed. In large areas with big groups of people where it's difficult for an ambulance to get access. So they carry a smaller amount of equipment than we do, but still things that they can help somebody immediately if needed. We do not have a CBRNE team, but there is services in Ontario that do have this. It stands for Chemical, Biological, Radiological, Nuclear, and Explosive. They're a specialized team that handle any of these. They're like a hazmat team. We do currently have the Guelph Fire Department has a hazmat team, so we utilize them or surrounding services if needed. We're a small service, so maybe when we grow, we'll be able to implement something similar ourselves. Same goes with tactical paramedics. Some of the surrounding areas have implemented them. Again, it's difficult with being a small service. You need to have so many people trained up in it, and we're just not quite big enough yet. But what they do is they respond to calls with the police, and they do training with the police on any barricaded individuals, active shooter things, stuff of that nature. So, what if you need to call 911? I'm sure some people that I'm speaking to today have had to do it, but maybe you haven't. And luckily, with any luck, you may not have to. So when should you call 911? For you or for anybody else? I think the best answer to that is if you ever feel it's necessary. If you're on the fence and you think, do I need to call or don't I need to call? Then I would call. We're happy to come out. We don't always take people to the hospital. If it's not necessary, if somebody does not want to go, we don't always take them. We always give our recommendation and advise people that they should go. But if you're even not sure, the best thing to do is call us, and we'll send somebody. When you do call 911, I don't know if anybody has any experience in this, but when you call 911, the dispatcher that you're talking to asks a ton of questions. What a lot of people have asked me is, why do they ask so many questions? I just need to get an ambulance to my house. And the answer to that is, as soon as you call and you give that address, that information gets put from the call taker to a dispatcher, and an ambulance is already in the process of being dispatched, even as you're still talking to them. So while you're on the phone with them and we're making our way to you, they're trying to gather as much information as they can so that they can relay that to us. We just recently had a new system put in our ambulances where we have a screen that gives us information as it comes in. So if somebody says, oh, this person has a history of allergies to anything, it will come up on our screen and it will give us that information. So they just try and garner as much information as they can to help us be prepared and know what we're coming into, and to give us as much information to help you or the patient who you're calling for. One thing I always like to tell people is just make sure that your house is easily seen, the number especially. It's amazing sometimes how hidden the numbers on the houses can be. So if that's something that you might want to have a look at, this makes that much easier for us to get there quickly if you need it. And what should you have ready if possible? If you have an opportunity to have things ready for us, or have somebody who's there with you, have something ready for us, it just makes things go a lot faster, get you to where you need to go quicker. So things like medications, or a list of medications, current medications, your health card. If you can't find your health card, that's okay. There's ways of, it's not like they'll refuse you at the door if you don't have it. There's ways of finding the number. File of life. I'm not sure if anybody is familiar with the file of life. I'm going to talk about that next. But that's a great thing to have handy. So this is what a file of life looks like. It's specific to Guelph Wellington Paramedics service. Most services, if not maybe all services, have something similar to this. I think in a couple of services it's called the vial of life, and it's like a medicine vial that you keep with your medications, and it has a piece of paper inside in order to relay the information. Ours has a magnet on it, so you can stick it to your fridge or something metal. It's close by. Our paramedics all know to look for that in the kitchen or near the front door. And it just gives us a lot of information. Your name, your health card number, any medications that you might be on or the patient that we're coming to see might be on, allergies, emergency contact numbers, etc. They're very important because you never know if you may have to call and you're unable to give us that information. So it's there and it's readily available for us. Other things you might want to have available is a do not resuscitate order if you do have that, or if the person has that, because we want to respect people's wishes with regards to that, because a lot of things that we do when people are very, very critically ill is quite invasive, and we know that some people don't want it. So it's important to have that available to us because we have to actually see the piece of paper in order to be able to respect that mostly. We'll have a conversation as well, and we can always call our doctor. And emergency contacts. So most common things I think that people call for that are very serious in nature and that you may not know how well we can respond to these things and how important it is to do it in a timely manner are CVAs and MIs, also known as strokes and heart attacks. There are two different kinds of strokes. One's an ischemic stroke and one is a hemorrhagic stroke. I'll quickly, for your information, you don't need to know this. You don't need to tell anybody that you're suspecting you're having an ischemic or a hemorrhagic stroke, but the ischemic stroke is something like a blood clot or a piece of plaque or something, blocks the blood flow to part of the brain. And a hemorrhagic stroke is when an artery or a vein or some sort of vessel ruptures, causing bleeding around the brain. We try to determine, along with the hospital staff, when we go to a call that we suspect is a stroke, they present very similarly. The one with the clot is a lot easier to reverse. There is ways of getting that clot even out of the vessel if it's done quickly. So signs of a stroke, everyone's probably seen this mnemonic before, FAST. You look for face drooping, arm weakness, difficulty with speech, and then it's time to call 911. If you notice any of those things, it's time to call 911. even if it's just one. Even if it's just speaking difficulty, but you can move all your limbs, moving around fine, no weaknesses on one side or the other, just having a difficulty finding that word or those words, or unable to speak at all, that can be a sign of a stroke as well. It's very important because time is brain. Almost 2 million brain cells can die every minute that they don't have oxygen. So because of this need for timely care, paramedics can now bypass other hospitals to go to a local stroke center. We're lucky enough here in Guelph that our hospital here is a regional stroke center. So everywhere from our service area can come here for strokes. So we do transfers from the field up in even Mount Forest and et cetera, coming down here to the stroke center. So we can bypass local hospitals, which really saves time and brain cells. So they have a local stroke center where they can, they have a very specialized response. We initiate a stroke alert as soon as we suspect it, even when we're in the person's house or wherever we are. And they immediately, the hospital activates their stroke team, and they have a special group of people come in and they'll meet us right at the door. And you go right for a CT scan, almost immediately, on our stretcher. So they can give clot busters to try and remove the clot, or if they feel that it's appropriate, they can send a patient down to Hamilton General Hospital for clot retrieval. They actually do that. They'll go in like they do for heart attacks. They'll go right in and they'll try and take the clot out. It's amazing how effective it is. People can get back to their complete normal sometimes. It's a great advance. Heart attacks as well, or myocardial infarctions, they're called. So that's similar to a stroke in that something's blocking the blood flow to the vessels in the heart. And just like time is brain, time is also muscle. Irreversible damage can begin within 30 minutes of oxygen-laden blood not getting to that muscle. So because of this, again, they've developed a program where paramedics can bypass local hospitals and take heart attack patients directly to cardiac cath labs, bypass the emerge, go right upstairs to the cath lab, and bring the patient right into the lab. Our closest cath lab is St. Mary's Hospital in Kitchener. So we still have quite quick access to cath lab. And if we can transport within 60 minutes of getting to the patient to that cath lab, then we'll go. So we have quite a large area that we can transport directly there. We also have agreements with other hospitals. So if a patient is, say, out in Hillsburg or Orangeville or something like that, where we're doing a call for another service, then we can go to places like South Lake or Brampton Civic. This just shows what happens at the cath lab. They do an angiogram. They look and see if they can find the blockage, and then if possible, they fix it by either putting a balloon in or sucking out the clot or putting a stent in right away. I've done calls where the time from the 911 call to the time that we had the patient's coronary artery reopened was 45 minutes. So it's pretty phenomenal what we can do and what they can do when we get patients there quickly. So as I talked about before, paramedics also have the ability to bypass their local hospital and go directly to trauma centers, either by orange ambulance or by land ambulance. So we do have the ability to bypass our hospital and go directly to trauma centers as well, if we're within 60 minutes again. So I don't know if anyone's heard of the golden hour in trauma, but you really want to try and get somebody who's sustained massive trauma into the ability to have surgery and really dedicated trauma team within 60 minutes. So we go to Hamilton General for that. We also do a lot of community engagement and involvement. You'll see us around all over the place. Come say hi whenever you see us. On the left is a display that we had at the Stone Road Mall for Paramedic Services Week last year, I believe. On the right is at Hillside Festival. We used to provide care there and medical support there, or bike medics. We also take part in a lot of ceremonies around, like Remembrance Day. Sorry, and also on the right, that's just one of the, actually from this summer, from the hot summer nights that the fire department started. They've invited us and Guelph Police Service to join them, and seeing families and kids at the parks throughout the summer. We have a response unit that is in the city primarily, and it gets to calls really quickly if we don't have a transport unit to send. So you may see them running around downtown usually. And that's all I have for you today. Thank you very much. I'm here to answer any questions. I don't know how you usually do this. If you want to have questions now, or if I'm around, I can stick around for a bit if anybody has any questions. We currently have 200 paramedics on our staff right now.
But basically, what is the number of people enrolled for this program?
There's quite a few programs now throughout the province. Some of them are 2-year programs. Some of them are run through some of the private colleges are doing a more quicker course that is more constricted. They don't get as much time off, so they do it in about 16 months. But there's definitely not enough paramedics coming out there for the increase in need, unfortunately. But there's hundreds coming out every year.
This question is, you hear about all the nurses are moaning and groaning, people are leaving the field.
Mm-hmm. We're seeing a similar trend, especially after the COVID-19 pandemic, where some of the enrollment in the college courses is decreased, definitely. And our turnover, we do have people, leaving to go to other careers and things like that. I think we're seeing it more, though, with people not enrolling in the program as many, so you don't have as many new paramedics coming out there to get, and every service wants a lot of paramedics every year too.
And then, with the salary, is it pretty comparative to nurses when you first come out from being trained?
I think it's pretty similar. Yeah, I would say it's quite similar salaries. I would say between nurses, and there's different levels as well. Primary care paramedics. And there's different levels of nursing as well that increases your pay as you go also.
And that is supplied by provincial government, correct? The paramedic and all this.
The paramedic programs are subsidized by the province. So Guelph and the county of Wellington pay for half of the services, and the province pays for the other half. After that was an agreement made when they downloaded all of the services down to the municipalities, the province agreed to continue to pay half of the costs of running the paramedic programs.
Thank you.
You're welcome.
This isn't a question, I just wanted to share something. We were in London, England, and I had an emergency, had to call for the ambulance, and the first person to turn up was a paramedic on a bicycle, because the traffic is so bad in London that it took the ambulance another half an hour before it reached us. But she had these big panniers on the bike, back and front, and all sorts of equipment. It was amazing.
Yes, yeah, it is amazing what some of other cities around the world are doing. They have paramedics on motorcycles as well, some places, different things to get to people quickly. Yeah. Even, I think in London, they even do, here the helicopters will go to places where it's a long distance from the hospital to the trauma center. Whereas in London, I think they'll respond within the city from the helicopter, just because of that traffic problem that they have. That it's actually quicker to get a helicopter somewhere from within the city to the hospital as well. Sometimes it's pretty interesting.
And I do have a question. Do in the training, do the paramedics have to be strong? I say that because we had another incident, and they had to move somebody from upstairs downstairs to the ambulance, and there were just two young women, but they managed it, and with no problem. But is there some sort of requirement to?
Yes, there is. There's certain physical abilities testing that paramedics, potential paramedics, have to go through in order to be able to continue in the hiring process. So there is physical abilities testing for that. And then also there's been really good advances similar to the stretcher that I showed you. We have other means of getting people out of homes, and we have specialized pieces of equipment like stair chairs. Yeah. We have recently had one, well, I say recently, but it's been within probably 10 years now. We've had stair chairs with tracks on them, so we can put people down the stairs without having to necessarily lift them. Lots of advances in technology to help that way as well. And we have a lot of different pieces of equipment to help get people in and out of places, smaller places like canvas stretchers, and we have adjustable other types of stretchers and things like that too.
Yeah. And I just thought of something else. At the Ignatius property, they have ski trails there, and supposing somebody had a problem way back in the bush, and you were called, how would you get to?
So we have Guelph Fire Services and Fire Department and Guelph Paramedic Services have a joint gator that we own. So that's kept at the Guelph Fire Headquarters, and we can activate that whenever we need to. That will get into places like that. We also have agreements with all the surrounding fire departments that own. Every other fire department in the area, the volunteer fire departments, they all own similar types of vehicles that we can ask them to activate to help us get access to people.
Oh,
yeah.
Okay, that's good to know.
Yeah,
Good to
it's
know.
very handy.
Yes, thank you.
Where could we get one of the magnetized information sheets?
Oh yeah, my apologies. I forgot to actually mention that. I left a pile of them out on the table where your name tags all were there. So feel free to grab as many as you need, one for yourself or anybody who you feel might benefit from having one. Yeah, thanks a lot for the reminder.
It seems like the paramedic service is very fast and efficient here in Guelph, especially in regards to heart attacks and strokes. But I've read about backups at Guelph Hospital, where people have to stay in an ambulance until they can be admitted or seen in emergency. How do you deal with those kinds of situations?
We have a good partnership with Guelph General Hospital, so we work in conjunction with them to try and find ways to minimize that offload delay. We still do have intermittent offload delay issues, and that usually stems from the hospital getting particularly busy and everything backs up. So you have people on the floors, you don't have beds opening up, people aren't being discharged, and you have people in the emergency room waiting to be admitted. So that uses up a lot of the emergency room beds, and that kind of leads to us being delayed as well. But the management at Guelph General has been doing a lot of things to try and minimize that, and we've been seeing a big difference, thankfully. It's been very good, especially compared to other municipalities. So we work together with them, and when we have those things happen, we try and stay on top of it together and try and get our ambulances out there as best we can.
So if they're backed up there and you have to stay at the hospital
Yes.
with the patient
Yes,
until
unfortunately.
then what happens to all the calls that are backing up?
So that's where we run into, where we don't have as many ambulances as we would normally have, so our response times get bigger and longer. And so we do things like sometimes one crew will look after multiple patients if they're not very serious in nature. They'll look after two to get another ambulance out on the road. Or we also, our services are very seamless, so we help other municipalities and regions, and they help us out when needed as well. So if, say for example, in Waterloo region, if the hospitals are really backed up there and they're losing a lot of their ambulances, we'll help out and do some calls in that region and go over there to help them, and they come here to help us in return. So yeah, it's a thing that unfortunately in my time, I've been doing this for over 25 years now, and an offload delay has been an issue for almost all of it, unfortunately. Well, we just really, hopefully, can find some strategies to help fix it. But whatever the management's been doing at Guelph General has been working, though. It's been less of it, which is great.
Well, this is a related question. I just want to ask, how many ambulances do you have in the city of Guelph?
So we have different number depending on the time of day. Our peak ambulances in the city itself are during our peak times. The most we will have on will be 7 ambulances and a response vehicle in the city. We have 3 running out of downtown at 34 Gordon, and 2 out of our Elmira Road base, and then 2 out of our Clare Road base, plus an emergency first response vehicle. And then we have a supervisor for the city of Guelph as well.
So do you feel that that's enough?
No, we could always use more, for sure. And I think we do. We're hoping that we'll be able to put another ambulance on the road shortly. We have meetings with the city and projections of what we might need in the future based on some consultations and where we see the trend of the volume of calls and things of that nature. So we have what we call enhancements come through periodically that give us more ambulances on the road, and so we're hoping to put another one on the road soon.
I just want to thank the emergency services because I had to use them, I think, 3 times in the last few years, and I'm alive.
Great. I'm happy to hear it. I hope your experiences were good all those 3 times.
They were very good.
Thank you. If you have to call an ambulance, right, do you have to pay, or is it covered by OHIP? If the ambulance service came and said, oh, you really don't need this service, do you still have to pay? And how about the fire department, if you call the fire department? Is it the same?
Yeah, so you do, the OHIP, in Ontario, OHIP covers most of the ambulance bill. Private insurance, if you have it, may cover the balance, but OHIP covers all but $45 of it. I think it's somewhere around $300 is the kind of number they put on it, $300 to $400, somewhere like that. I know it changes time to time, but everybody in Ontario gets subsidized, and will get you get a bill for $45 unless you have insurance to pay for it. You don't have to provide that payment to us. We don't do the billing. It's all done through the hospitals and the province and everything like that. So nobody has to worry about if they can afford it or not. You'll always get an ambulance. Some provinces actually don't cover it. I know I'm from Alberta originally, and out there they don't cover their ambulance bills. So if you call an ambulance, you get a bill for $315, I think it is. So a little bit different from province to province. Same thing goes with the fire departments. I think they operate a bit differently from department to department. So it depends on the nature of the call. You won't get a bill from the fire department for coming to a medical call. I think they sometimes bill for other calls, like if it's a rescue of some sort or something like that, they may charge, but I can't really speak to that. I'm not really sure. I think it changes from fire department to fire department. If you do call, the only way you will get charged, you'll get an ambulance bill, is if you actually get transported to the hospital. If we come and look you over and you decide you don't want to go to the hospital, we will never refuse to take you to the hospital and should always recommend you go regardless. If you're concerned enough to call us, then we're always happy to take you. But we're not going to kidnap you and force you to go either. So if you don't wish to go, that's completely up to you. We have a refusal of service form that you can sign. And unless we actually transport you to the hospital, there's no charge or no bill. Same goes with interfacility transfers. If you need to go from one hospital to another hospital for some specialized testing or something like that, you don't get a bill for that either.
Well, thank you very much, Jim. It was fascinating.
Thank you.
I have to tell you that my wife and I worked on a volunteer ambulance service back in South Africa about 40 years ago.
Oh, yeah.
And I think we had a 1-week training session in the evenings, and that was the end of it.
Yep, very common, yeah.
And so we used to go by something called scoop and run,
Yep.
and just get people off as quickly as possible. I do have one question.
Sure.
In identifying strokes, they're a rush call for you, I imagine. Someone doesn't know whether they've had a stroke, but I presume the ambulance driver will realize it as they arrive there. Do you have a particular protocol for that?
Yeah, we do neurological assessments. So we have certain assessments that we do to determine if we feel that it's a stroke in nature, regardless of if there's somebody calls and they're just feeling generally unwell, even without any real specifics. We do a lot of questioning to try and determine what the problem might be. And if we feel that there's a neurological problem going on, then we do assessments. And if we think that there's a possibility that the patient's having a stroke, then we do our stroke bypass as well and our stroke alerts. Right now, we were working on a time frame of 6 hours from time of onset. We'll still take the patient to the hospital, but they may not be activated. But that time frame is always changing because it's changed. It used to be 3 hours, now it's 6 hours. I know Guelph General uses, I think, 24 hours as theirs in order to try and determine whether a person needs to go for clot retrieval. So things are always changing as advancements in technology and medical care change too. So, but yeah, we take it very seriously. We're fast on it if we recognize it.
Okay. The other question is, why do the ambulance attendants have to stay with the patient until they're actually in the hospital? Because that seems to take an awful lot of time. Yeah,
it's a continuation of care. So the hospital has only, their nurses can only look after so many patients at once, the maximum number. And so we all feel and agree that you need to have somebody looking after a patient. So unless they can be offloaded to the waiting room or to see and treat, if it's something very minor where they can sit in a chair in the waiting room, then we will stay with them just in case something changes. And that we can give an accurate report to the person who's taking over, the nurse that's taking over care. And it's funny you mentioned the scoop and run thing back. A few decades ago only, before we had so many advances in technology, we used to call it BOB. It was bed, oxygen, blanket, because that's basically all we had, right? It was, we could offer you a bed, we can offer you some oxygen, and we can offer you a blanket, and diesel therapy, they called it. quick drive to the hospital. But it's amazing what's changed in the last, even since I've been a paramedic, the changes is just unbelievable.
I believe that.
Yeah.
Thank you very much. Jim, thank you very much. It's really reassuring to know we have such a wonderful service here in Guelph, and really appreciate your coming out today and sharing your expertise with our group. Thank you. Thank you very much indeed.
Thank you very much for having me. Yeah, thanks a lot for having me. I really appreciate it. I love getting out and speaking to people and having people learn what we do. And I'll stick around for a little while. If anybody has any other questions that they've thought of, I can answer. Okay. Thank you very much.
Thank you very much
Thank
indeed,
you.
Jim. Thank you, everybody, for coming along today.